You are about to start the Violence Prevention Module 2 titled Adopt Practices for Violence Prevention. It will take approximately 10 minutes to complete. When you have finished the module, proceed to the short quiz to help test your learning. If you have any trouble with the answers, speak to the safety advisor on your unit. Now, let's begin. This module is primarily about one of the things that staff do to cause a patient to become aggressive or angry. It's a little like Space Invaders of a different kind. You must have at one time told someone, "Hey, you're invading my personal space." Let's see just what personal space is defined as. The Webster Dictionary defines personal space as the distance from another person at which one feels comfortable when talking to or being next to that other person. Think back to how it made you feel. Uncomfortable? Anxious? Angry? This is what your invisible personal space looks like. Imagine you are walking around all day with these colored rings on the floor. What does it feel like when someone starts venturing into your intimate circle? Now, imagine if this person was a total stranger. Healthcare workers are often called intimate strangers because they need to go into a person's personal space to give them care. They enter the intimate zone, and they are strangers. Intimate strangers. So let's talk about how you can reduce your risk. Notice whether your patient is becoming agitated or uncomfortable. Look for the signs. Anger. They could be crying or yelling, kicking, and even sometimes being eerily quiet. Staff are at a greater risk of personal injury from acts of aggression when entering intimate zones. There are things you can do to lower your risk and decrease agitation, anger, and fear in your patient. Reducing these things will also reduce the chances of you being injured by a violent patient. So what are some of the things you can do to reduce your risk? Keep at least a leg length away. This will help prevent you from being kicked. Make sure they see you come up close. Coming up behind someone could scare them and cause a violent reaction. Tell them what you need to do with them. Answer their questions. Be respectful. Introduce yourself. Knock and wait for an answer before entering their room. These are just a few of the many ways you can choose interactions with patients that will not cause aggression. Be sure to check out the many books and videos in True Health's library for more great resources on how to decrease aggression and violence in your workplace. True Health wants you to stay safe at work. Thank you for completing this module.